The following segment is paid for by DispatchHealth.
They bring the power of the hospital to you. DispatchHealth offers top-rated medical care to Las Vegas patients of all ages, from same-day medical needs to complex conditions. And joining us now with more about them is Dr. R.J. Pua, the DispatchHealth Las Vegas Medical Director. Good morning to you.
Good morning, Micah. Good morning to your viewers.
Well, we appreciate your time this morning because I'm really intrigued by this because we have this idea of what a traditional house call looks like, but you're different. It almost sounds like you can do so much more than what we think.
Yes, we do. Like what you said, Dispatch Health brings the power of the hospital to the comfort of the patient's homes. We have capabilities for moderate complex labs, portable ultrasounds, and we have in-home imaging that immediately directs and impacts the plan of care for our patients. We're able to administer intravenous fluids, medications. We can run EKGs. We can run rapid test kits for certain infectious diseases like flu, and most recently for COVID. And we are able to write prescriptions right from the patient's living rooms. And we are able to share our notes with the patient's primary care physicians because we see ourselves as extension of the patient's medical providers. We truly are a system of care in the home setting, and we are led by emergency room and hospital trained physicians. We also have advanced care providers, nurses, and medical technicians to complete our team.
And you guys have actually been taking care of our valley for going on 5 years now. So what would you say to patients and their families that might find most surprising?
Yes, we've served our community for the past 5 years now, and they've responded very positively, mostly through our urgent care and ER care service line. They love how convenient it is to just call a number, and then we screen them, we triage them, and then they just have to wait for a medical team to be deployed and see them at home. And we provide high quality, professional, and reliable care. They don't really have to worry about being transported to the hospital or to the emergency room when they're not feeling well, and they usually dread just the idea of having to wait for long periods of time while waiting to be seen by a medical provider. We also recently launched another service line called Advanced Care, and it's a hospital substitution. And this allows Dispatch Health to treat patients for certain acute conditions at home that they usually would have caused them to stay in the hospital for 3 to 5 days. So as we navigate through the many challenges of healthcare delivery, such as we have seen in the pandemic the past couple of years, Dispatch Health will continue to evolve so we can continue to meet the needs and demands of our community.
And when you go there, it's very convenient, and convenience kind of sounds expensive. How does the cost of having Dispatch Health come to your home compare?
With our extensive partnerships and collaborations with major insurance companies, in addition to the usual Medicare and Medicaid insurance, it's allowed us to deliver high quality and affordable care at home. We usually bill like an urgent care visit, but we bring the care to the patient's homes. We are open 7 days a week, 365 days a year, and we are committed to serving the community as much as we can with safety as our top priority.
One question that might pop up then from patients, are you really able to provide that same level of care then?
It is quite surprising, but yeah, we do have the capability to treat complex medical conditions, many of which patients, are even surprised to learn that we're able to do it at home. We're able to manage cuts and lacerations that require stitches, severe migraines, infections like UTI and pneumonia, and even COPD and chronic heart failure exacerbations. We pretty much can care for nearly everything in a patient's home, short of any life-threatening or limb-threatening injuries and illnesses that require surgical intervention or high level of care, such as close ICU monitoring.
Well, I love the convenience of this, and I'm sure that the other patients do as well. What sort of feedback have you been getting overall?
It's been very rewarding so far being the medical director of Dispatch Health, but, treating the people in their home, it gives us a unique and direct insight into what are the drivers that maybe impacted their health. Not to mention that we are, intimately treating the patients at their home, which makes for a stronger connection between us and the patients. We get to see the environment that they live in, what kind of support that's available for them, what sort of foods they're eating, and if whatever environment that would be conducive for their healing. We call this the social determinants of health, and it's a key tool for us to be able to treat our patients successfully.
I like that because, as you mentioned, that you're able to see that habitat, and maybe that could be a potential issue with their problem. So we appreciate your time this morning. Very convenient with this. Is there anything else you'd like our viewers to know before we wrap things up?
Well, yeah, just thank you for the opportunity, and we're looking forward to serving our community for the next 10, 15 years to come. Thank you.
Well, RJ, we appreciate your time this morning.
Thank you.
It's in your home on your terms. Dispatch Health, again, brings the power of the hospital to you. Their website, phone number right there on your screen. That's dispatchhealth.com, or call this number 702-825-7275.